Hi, my name is Andrea Wolf, and I'm a registered dietitian at Stanford Healthcare. I'm going to discuss 5 tips for creating a healthy plate to support your kidneys for chronic kidney disease and discuss plant-forward dietary patterns to help protect your kidneys and prevent disease progression. Before I get started, I want to emphasize that a kidney diet should really be individualized to your specific health needs. People with chronic kidney disease may be at different stages, have different labs, other health considerations, and different nutrient needs. So I do recommend working with a registered dietitian to determine your specific needs. Before we get into the 5 tips for creating a healthy plate, I'm going to review plant-forward dietary patterns. Plant-forward or plant-dominant diets may be beneficial for chronic kidney disease due to they may help improve blood pressure and improve blood sugars. Diabetes and high blood pressure are common causes and complications of kidney disease. Thus, following a whole foods, plant-focused dietary pattern may have a positive impact on your kidneys. Plant-focused diets may also help with other complications of chronic kidney disease, such as metabolic acidosis, mineral imbalances due to lower protein load on the kidneys, and often contain less phosphorus and potassium than animal-based diets. High fiber content from plant foods may also promote healthy gut bacteria, in addition to possibly improving cholesterol, blood sugars, which are all beneficial for kidney health. Plant-based diets are also rich in antioxidants, which help lower inflammation, which is helpful for your heart and your kidneys. Examples of plant-forward diets I have shown here on this slide include the DASH diet. So if you see this pyramid here, the DASH diet focuses on lots of vegetables, fruits, whole grains, low-fat dairy products, fish, poultry, beans, and nuts, while limiting sweets and fatty meats. So here at the bottom of the pyramid, vegetables and fruits, that's what you want to eat most of, 8 to 10 per day, and then limiting the sweets to less than 5 per week. The Mediterranean diet shown here is similar with a focus on lots of vegetables, fruits, beans, lentils, nuts. There's also an emphasis on whole grains, olive oil, omega-3 rich fish such as salmon. There's moderate intake of cheese, yogurt, and little or no red meat and sweets. So again, here at the bottom of the pyramid, lots of veggies, fruits, whole grains at the top, limiting the meats and the sweets. The Plato diet differs from the DASH and Mediterranean diet. So here's the Plato diet here, which is plant-dominant, low-protein diet. The difference is that it really focuses on a low-protein diet for kidney disease and for more than 50% of protein to be from plant-based sources. All of these dietary patterns focus on whole foods, and whole foods are foods that are minimally processed and remain close to their natural state. They do not contain added sugars, artificial ingredients, or preservatives. In contrast, processed foods are foods that undergo extensive industrial processing and contain multiple ingredients, including additives such as preservatives, sweeteners, colorings, flavorings, and emulsifiers. To sum up these different plant-forward dietary patterns, I like to think of the plate method, where you fill up half your plate with vegetables, as you see here. A quarter is your protein, and a quarter complex carbohydrates or whole grains, and using healthy fats. Again, it's important to focus on whole foods and on minimizing these ultra-processed foods. So let's review each portion of the plate method. I want to talk about vegetables first because that is what we want to fill up on the majority of our plate or bowl with. So tip number 1 is to fill up half our plate or bowl with non-starchy vegetables. It's important to get in lots of vegetables due to they are rich in fiber, vitamins, nutrients, antioxidants, and may help reduce acid load for kidneys. We want it to be filling up again half our plate with non-starchy vegetables. Starchy vegetables are still okay to eat, such as corn, potatoes, and beans, but they contain more starch or carbohydrates, so we don't want to fill up half our plate with them because they may impact our blood sugars more. Concerns around vegetables are often related to potassium with chronic kidney disease. However, not everyone with kidney disease needs to watch potassium intake. And even if you do, it's still important to eat lots of vegetables and focus on the lower potassium vegetables, as you can see here on the right hand of the slide. So there are lots of options, even if you need to be watching your potassium intake. Potassium is helpful for our heart health and blood pressure. So again, only restrict potassium if you need to. Arugula, bell peppers, carrots, cabbage, cauliflower, kale, asparagus, green beans are all great vegetables that are low to moderate in potassium. Also, potassium absorption in the gut is hindered by fiber. So you're not going to absorb all of the potassium in vegetables versus food additives that are potassium-based, such as potassium sorbate, are almost 100% absorbed. So again, we want to focus on this whole foods diet. The goal is to get in at least 5 servings of vegetables, of the non-starchy vegetables a day, a half a cup cooked, 1 cup raw, or 2 cups of leafy greens equals 1 serving. So how are we going to get in all those vegetables? So here are some ideas. So you can even start the day off with adding in vegetables. You can add in vegetables to scrambled eggs, such as leafy greens, peppers, onions, tomatoes, mushrooms, and zucchini, or make a tofu scramble with lots of vegetables. You could do a breakfast taco with beans and vegetables, such as pepper and sauteed spinach. You could do a veggie smoothie. Just to let you know, kale is lower in potassium than spinach if you're adding some leafy greens to your veggie smoothie. You could even consider having a salad in the morning and maybe you add a poached egg on top. For lunch and dinner, you can add in extra vegetables to soups, stews, stir fries. Often if I'm making a recipe, I'll double up on the vegetables for my soups and my stews. Add in side salads to your meals or make the salad your entree. Consider low carbohydrate veggie substitutes such as cauliflower rice or zucchini noodles. Cauliflower rice bowl or fried cauliflower rice can make a great meal. If you're having a kebab, add in more vegetables than meat. Consider roasting your vegetables to bring out their sweetness. And add in vegetables to your snacks to get that 5 servings per day. So you could do cut up vegetables with a dip, such as hummus or a yogurt-based dip, kale chips, stuffed mini peppers with cream cheese or goat cheese can be a great option for a snack as well. So there's lots of ways to sneak in your vegetables to get into 5 for a day. Tip number 2, choose plant-based proteins half of the time. So protein is an essential nutrient for building muscle and repairing tissues in the body. When the body breaks down protein, it creates waste that the kidneys need to remove. Eating a diet rich in protein in excess of what your body needs may add extra work for the kidneys. We want enough protein to support our body, but not too much. So consider filling up a quarter of your plate with protein or aiming about 2 to 3 ounces of protein. So that's about the size of a deck of cards or about the palm of your hand. Protein is present in both animal and plant foods. Protein-rich animal foods include red meat, chicken, fish, eggs, and dairy products. Plant-based protein sources include grains, beans, and nuts. The goal is to choose plant-based protein sources, again, about half of the time. Just like not all the potassium in plant-based foods is absorbed, only about 30 to 50% of phosphorus in whole plant foods like beans is actually absorbed. So even if you're watching your phosphorus intake for your kidneys, yes, it's still okay to eat beans. Again, we want to focus on minimizing processed animal meats such as hot dogs, sausage, bacon, which are often high in unhealthy fats and sodium. Also recommend limiting the processed plant-based proteins, which may have potassium or phosphate additives and actually be loaded with sodium. If you want more information on protein for your kidneys, you can check out the video Protein Tips for Kidney Disease. Tip number 3, choose complex carbohydrates. Carbohydrates often get a bad rap. However, carbohydrates are the preferred source of fuel for our body. It is important, though, to watch portions and choose more fibrous carbohydrates to help maintain good blood sugar control. And fiber is essential to gut health, digestion, and prevention of chronic diseases. So it's going to be helpful for our kidneys. If you are concerned about whole grains and phosphorus, again, only about 50% of phosphorus is absorbed due to phytates in plants. Therefore, it is okay to consume whole grains with chronic kidney disease. Certain examples of whole grains are quinoa, steel-cut oats, sprouted wheat, beans, whole fruits, lentils. Lower potassium and phosphorus carbohydrates are barley, buckwheat, bulgur, wild rice. Even if we are choosing complex carbohydrates, we still need to watch the portions because we don't want our blood sugars to be elevated. So fill about a quarter of your plate with complex carbohydrates. Tip number 4, choose heart-healthy fats. Healthy oils are important because fat is needed to build cell membranes and nerve tissue, help absorb fat-soluble vitamins such as vitamin A, D, and E. The goal is to focus on unsaturated fats such as olive oil, avocado oil, nuts and seeds, because they may be helpful for lowering the risk of heart disease, which is going to be helpful for your kidneys. Omega-3 rich fish are also great sources of healthy fats, such as salmon, mackerel, sardines, herring, and trout. Lower potassium fat sources include a small portion of avocado. If you eat the whole avocado, it is going to be high in potassium. But if you have a quarter of an avocado or a small portion of it, it is considered low, moderate in potassium. So it's all about the portion. Walnuts, pecans, macadamia nuts, chia and flax seeds, pumpkin seeds, olive oil, and avocado oil are all great sources of fats you can add into your diet and that are lower in potassium. Last but not least, tip number 5, watching sodium intake. Managing sodium intake is crucial for individuals with chronic kidney disease to help control blood pressure, reduce fluid retention, and decrease the risk of heart disease. So here are some tips for watching sodium intake. So use fresh ingredients, fresh fruits, vegetables, and meats that are naturally low in sodium, and limit the processed and prepackaged foods that are high in sodium. Flavor with herbs and spices. So use herbs, spices, garlic, lemon juice, and vinegar to flavor your food instead of the salts. Limit high sodium foods. Just a reminder, the majority of salt or sodium in food is in packaged food or from restaurants and not from home cooked meals. So again, we want to watch the processed foods, be cautious of condiments and sauces that are often high in sodium, and restaurant meals. Also, be cautious of salt substitutes. So if you're using a salt substitute, make sure you look at the label and it's not potassium based. We want to avoid the potassium additives that are 100% absorbable. To sum it up, by making mindful choices and prioritizing a whole, minimally processed foods dietary pattern that is plant-focused by filling up half our plate with non-starchy vegetables, getting in 5 servings daily, choosing plant-based proteins at least half of the time, and watching our portions of protein and carbohydrates can help protect your kidneys, improve your health, and overall well-being. Thank you so much for your time and attention, and that concludes this talk.